Good evening. I'm Mayor Donnie Tuck. I'd like to welcome you to another Facebook Live broadcast featuring our emergency management team with a panel discussion about what the city's doing to keep you safe. It's been 5 days since Governor Ralph Northam declared a state of emergency in Virginia and advising of gatherings not more than 50 people. Since that time, he's advised of gatherings not including more than 10 people. And so tonight we want to have another panel discussion telling you what we're trying to do to keep our city safe. Tonight's panelists feature our city manager, Mary Bunting, our communication strategist, Robin McCormick, our chief of police, Terry Solt, our chief of the fire and rescue, Jason Monk, and tonight, Dr. Steve Julian, who's the acting director of the Hampton and Peninsula districts. With that, tonight's panel.
Thank you. As the mayor said, we have Dr. Julian from the health department with us, and we've got some advanced questions already to ask him, but I do want to encourage you to do the health questions up front because he represents 2 health districts and he's going to need to leave before the rest of us. So can you just give us an overview of what coronavirus or COVID-19 looks like on the peninsula and Hampton area right now?
Sure. Good evening, everyone. Thank you for having me here. I want everyone to understand that this is a serious health problem, but it is one that working together we can all defeat and we can all be safe. Currently, we have approximately 15 cases in the Peninsula Hampton Health District. Sadly, we have 2 deaths that have occurred from the COVID-19 virus. These numbers are changing literally about every 3 to 5 hours. I want everyone to know that the Virginia Department of Health website is updated daily at 12 noon, and the numbers will change at those times. We have a very active team of professionals in the health department that are working to contain this virus, and we're working very smoothly with our partners in emergency medical services, fire, rescue, police, and all other city services. I'm very gratified at the support we're getting.
Dr. Julian, tell us first about what the symptoms are and what people should do if they have those symptoms.
Yes. COVID-19 is a respiratory virus. It's in the class of viruses of the common cold. However, this is a mutated virus. It is usually spread by droplets, cough, sneeze. It can be spread from surfaces where somebody has coughed and sneezed on the surface, and then another person comes along, puts their hands on it, and then takes their hands and touches their face, mouth, nose area. The virus then invades through the mucous membranes, and as it does so, it causes an inflammatory response. The interesting thing about COVID-19 is that it has a particular propensity to infect the tissues of the lungs. Whereas the common cold is more of an upper respiratory infection, COVID-19 seems to be focused on a lower respiratory infection involving the lungs proper. The signs are fever, cough, watery eyes, very similar to the common cold. The fever can be as low as 99, as high as 105 degrees, anywhere in between, and usually shortness of breath and respiratory symptoms. When you have these sort of things, please, recognize them, pull yourself out of your routine activities, self-isolate yourself from others, and then make a call to your medical professional and get advice. It is not wise to go directly to the emergency room or the urgent care or anything of that nature. It is best to call ahead and have a conversation with your medical professional about your symptoms. They can then decide if it's appropriate for you to come in and be evaluated.
Thank you. And I will also note that this is really a very active allergy time and an active allergy season this year because it was such a mild winter. How can people sort of distinguish between those allergy symptoms and the possibility of COVID?
Well, you've hit upon an interesting phenomenon that we are going to have to now address because we have been in the wintertime, and that aspect of things we have not had to deal with. The challenge is that the symptomatology is overlapping. However, with the routine allergies, one does usually not have a fever and one does usually not experience shortness of breath. With COVID-19, fever, shortness of breath, respiratory difficulties are much more apparent.
Thank you. We have a question from someone asking about how they can get tested. They have a known connection to someone with the disease and have been told that they can't get tested yet. What does the testing parameters look like, and when do you predict that will open up a little?
So you've hit upon the Achilles heel of this entire situation. Let's be frank about it. There is not enough testing available. It's just that simple. It's in the pipeline to be developed. Many aspects of our society and our industrial medical complex are working hard to get tests out there and available. But right now, we simply do not have enough for all of those who want to be tested. We have to reserve those who are appropriately screened and appropriately symptomatic. The major things are, have you had an exposure to someone who's known to have COVID-19? That is one of the first criteria. The other criteria are the clinical criteria: fever, shortness of breath, those sort of symptoms. What's then done is a medical history needs to be taken. Your travel and your underlying medical conditions. Your age is taken in as a factor because it appears to be a much more virulent organism in those above 65 years old at the present time. All of these things are taken together to make an assessment. Testing can be done in two ways, and the testing is done by your healthcare professional, either at the hospital, emergency room, or the urgent care, wherever you're actually coming to see a professional if they decide it's appropriate for you to come in. There are two ways tests are done. The state lab has a testing procedure and specific CDC criteria that all medical professionals have in their inbox, so to speak, to understand what the criteria are. There is also private testing, such as LabCorp and others who are developing tests. Those tests do not require the same level of analysis in terms of symptomatology and clinical suspicion as does the state lab. State lab is following strict CDC guidelines. The private testing is based more on the clinician's suspicion of the evidence of the disease.
Thank you. We have a question. This disease seems to be easier on people under 18. Do we have a greater concern for those in that age bracket, though, who have asthma or other kinds of compromised immune systems?
Anytime you have an infectious disease, it tends to be a serious process in any individual, regardless of their age, if they have underlying medical conditions. So the short answer is yes, there is concern. The hopeful answer is, though, that this disease appears to be more virulent in those over 65 years old. Now, that doesn't mean that people who are under that age or between that age and children are not susceptible to the disease. They certainly are. However, most of the people who are in the younger age group, if they do contract the virus, it is a shorter-lived syndrome, and a much less virulent one. But still, if you have underlying medical conditions, please seek medical attention appropriately.
Thank you. I'm also going to ask, because we are protecting the people with this disease, their private information, how do we know if we've come in contact with someone? Will we get a call?
The way that works is by word of mouth in the community, and if you hear or become concerned that you have been around somebody with the disease, have conversations, find out what's going on in your community. Professionally, the way this is done is when we have an index case, we have individuals who are called epidemiologists, and they evaluate the patient, the symptomatology, working with your physicians and your doctors and nurses, and then do what we call a tracing, and they trace back every contact that the person has. You can imagine this is a very labor-intensive process and requires a lot of phone calls and tracking people down. Currently in the Peninsula Hampton Health District, we're already tracking over 350 individuals who've had contact.
Wow, That's a lot larger number than the diagnosed cases, obviously. It doesn't
is.
mean they will have it, right?
That is correct. What we're doing is using an abundance of caution and following the scientific methodology that we know decreases the impact of infectious disease in a population of patients.
All right, and Lee wants to know how far are we away from this peaking? And I realize that's impossible to answer, but just talk about what you've seen or what might happen.
Well, let's talk about what we've seen. This is called a novel coronavirus, which means it's new to us. And so we are learning each day. And that's why I want to reassure the public, it's not that the healthcare professionals do not understand what's going on and how to combat this. It is that the issues are changing and the information is accumulating as we deal with it. It is an important thing to understand that aspect of things.
And I read on the Washington Post today that it still hasn't peaked in Italy necessarily, that they continue to report more new cases even today. So,
well, that's a very good point. And so we have some models to look at. In China, where this seems to have started, what we saw there was what we call a bell-shaped curve. You have an increased number of cases, it rapidly rises and then reaches a peak and then falls off. That is characteristic of almost all infectious diseases when they ravage a population. What you want to have happen is what has happened in Japan and in Korea. Rather than the peak going up and being very high with the number of cases and subsequently the number of fatalities, you want to level that peak off. Unfortunately, in Italy, we have an example of where the peak went up very high, very rapidly. There's a lot of conversation about whether appropriate and enough measures were taken to contain this virus, and you have a very high peak with a high mortality rate. That is not what we want to have happen here, and that's why it is so important to take care, self-isolate, follow all the hand-washing guidelines so that we can defeat this together.
And Haley says she's heard reports from France that COVID is indeed affecting young people. And I think you said they do get it, but they tend to be less serious. Is that correct?
That is true. I'm familiar with the report that she's of which she is speaking, and that is controversial at this point. There, scientific studies to understand what a disease is going to do to a person or a population is understood over time with many, many cases and watching the treatment and the results. Unfortunately, we are in the real-time situation. We will know more about the age range differences after we have had more cases to treat, but everybody remember that one of the first victims of this was a 37-year-old physician in China who was the person who was sort of the canary in the coal mine, who was telling authorities, we have a serious problem, we have an outbreak problem, and actually he was castigated by authorities in China. He succumbed of the disease.
And I think it's important when we say tends to hit people more, a certain group more or less, that's not an absolute statement.
That is not. Having been in medicine for about 45 years, there are no absolutes. There are trends, there are patterns, but every human being experiences their illness in their unique way.
And Craig wants to know, he's heard that there may be different strains of this. Is that true? What do we know about that?
We do not know much about that yet. I saw one article yesterday that has suggested there may be a second strain. And I want to emphasize maybe. Remember, viruses tend to mutate. They tend to change their RNA, their DNA. And actually that's what's making COVID such a difficult problem right now. It is a mutated virus. And in the course of a pandemic like we're experiencing, the virus will continue to mutate. So I don't think that information is well enough known yet to support, but it's certainly quite possible. And we probably should anticipate it.
All right, I'm going to throw another one at you. Right now, the schools have declared that they're closed for 2 weeks. The city's closed for 2 weeks. Do you think that 2 weeks is a realistic time frame, or that might change?
Well, the first thing I'll say is I think that might change. The second thing I'll say is I do not have a crystal ball. The third thing I will say is that the closing of the schools and businesses and so forth, while they have incredibly important positive healthcare implications, there are also a lot of other implications related to food, choices for children who are getting their meals that way, and also for the economy and for educational purposes. I think, though, that this is a first step. I think Governor Northam will take a very careful look. I think in some ways, I think we're lucky that the governor of Virginia is a physician, and I think he will, with his experts, take a very careful look. I would not be at all surprised if this does not get extended, but that is something that we do not know at this point. Let's all self-isolate. Let's all evaluate ourselves appropriately, present to the physicians and nurses appropriately, do the appropriate hand washing and other activities, and hopefully we'll bend this curve, and maybe we will not have to go to that point.
Thank you. There's a call out that you're very informative, but what is your name? So I'm going to repeat. This is Dr. Steve Julian, for those of you who weren't here for the introduction, and he's the acting health director for both the Peninsula and Hampton districts. Now, we have a new question about masks. There's guidance from the CDC that people in general don't need to wear masks, but we're seeing masks on people who are medical professionals. So explain who needs masks, who doesn't need masks, what do they do?
So the general public does not need to mask. Data does not show that that actually decreases the true spread of the disease. Masks, which are in short supply and need to be of a special kind called N95 mask, we need to preserve for medical professionals because they are encountering the virus in much higher concentrations and much more frequency than the general population. There is no reason for people to mask at this time.
Okay, we have a question from Eric, who is a mail carrier. What are concerns that he should have about handling mail?
Data at the present time is not going to give him clear guidance, I'm afraid. So the way this virus is generally spread is through droplets in the air or for person-to-person contact. Now, there is data starting to come out about the viability of the virus on all kinds of surfaces, everything from stainless steel to cardboard. The most recent data I saw, one small study, suggests that the virus can actually stay in a aerosolized environment as long as 3 hours. On a surface, such as stainless steel surface, it may last as long as 24 hours. Most studies show that it's less than that. There is one study that shows on cardboard that the virus is viable at 24 hours. Now, I said the virus is viable. That means it's alive. But is it in a sufficient quantity and dose to be infective? And that's the thing we do not know. What I would suggest is that, one, use all precautions, hand washing, try as best you can, as hard as it is to do. Do not touch your face, your nose, your mouth, and use care and use common sense. Use Perel and the various hand sanitizers. I would recommend that someone in that profession have something like that they're carrying with them and use it periodically during the day. But we do not have any concrete evidence at this point that that's a serious source of infection.
Thank you. And Pam wants to know if there is a particular blood type that is more sensitive to this or not.
There have been some rumors on the internet that is true. I am not aware of any data that shows any difference between human blood types in relationship to this disease. Also, in respect to that, let me say that we are having a blood shortage right now. And we're having that because people were not able to give blood because many of the blood drives were in schools and other venues and have been canceled. So there's no evidence at the present time that giving blood would be of any negative impact, and there's no evidence that any particular blood type is more susceptible than another.
All right, and Wade has heard that breathing very warm air through the nostrils can reduce the chance of a virus attaching to your body?
I have to say there is no solid evidence of which I'm aware that would be beneficial. There is a small amount of evidence that with other coronaviruses, zinc in various types of things like coldies and so forth can mitigate the regular common cold. Whether or not that would be helpful with this coronavirus, we really do not know.
Vitamin D, has that been shown effective?
No evidence to show that
Okay.
that would be helpful, nor vitamin C.
So if we are suspecting that we're coming down with this, we have a little bit of fever, what should we take?
So there is information on the internet that perhaps you should avoid non-steroidal anti-inflammatories, such as ibuprofen, Advil, and the like. There is evidence that perhaps you should use acetaminophen or Tylenol for fever. What that is really related to is when people become very ill, one of the side effects of severe illness with COVID is not only the pulmonary inflammation and infection, the lung infection, but often an inflammatory response in the kidneys and kidney dysfunction, which can lead to kidney failure. Non-steroidal anti-inflammatories have negative effects on the kidneys, and that's probably why you should avoid those and use Tylenol instead.
Thank you. And Joanne wants to know, can you get this virus twice, or do you develop antibodies?
That's exactly the greatest question I've heard yet. The science on that is unknown, but theoretically, that could happen because, again, the viruses can mutate. It is not known. I am not aware of any reported cases where someone got over COVID and then got it again, but we're really early into this. So I don't think we honestly know the answer to that. Theoretically possible. I certainly hope it doesn't happen.
And Samantha asked, do we have community spread on the peninsula, or are all the cases related to the original cases?
The answer is we do have community spread. Not all the cases from our epidemiologic studies are related to the original cases.
Wow.
And that's why all the measures that we're talking about in terms of isolation and all of the appropriate health hygiene is so incredibly important. I understand that it feels uncomfortable to not be able to gather in groups of more than 10, to not be able to go to restaurants and other events that we have done in the past that we enjoy as privileges of living in America. But this is a time for all of us to come together, understand that we are interdependent, and that by working together, following the appropriate guidelines, we can beat this, and we can.
Thank you. And Angela wants to know, can the virus be spread to your pets?
That is a great question also. At this point in time, it does not appear to be so. There are recent CDC guidelines on this, and they are available on the CDC website.
Thank you. And Cassie wants to know, if you get symptoms, how long does it take before you're over it? What's the course of this? And I know it varies certainly among people.
It does. Let me first say, there is some concern right now that someone can be infectious who's totally without symptoms, because the symptoms just haven't shown up yet in the person. In general, the guidelines are 14 days of quarantine or isolation, or 72 hours without any symptomatology. The 14 days of isolation is a CDC recommendation at this point. The other point that I want to make is the current CDC recommendation is that before a person who has been diagnosed with COVID by the appropriate testing, before they return to work, they have to have 2 negative COVID retests, each 24 hours apart.
Okay. So speaking of work, we've got questions from a couple of people, Kim and John, who work either with the public or in a building that is definitely more than 10 people. Do we have specific advice in those circumstances?
So social distancing is appropriate, 6 feet. Additionally, not shaking hands in the usual manner. Additionally, washing your hands frequently. All of these are the measures that we can take. Use common sense in interactions with each other. But I think that is part of the human condition, and it is awfully hard to cone that down even more. That's why it is so important that if you feel ill, do not come to work. If you have been around and you know you are a contact with someone who has had COVID, consider whether or not you need to self-isolate at least for 72 hours to make sure that you have no symptoms.
Okay, these are also questions that might be a little out of your jurisdiction, but what do we know about a vaccine?
Vaccines generally take about 18 months from the time one has identified a virus such as this in order to be produced, tested, found to be safe, and then effective. It would be wonderful if we could develop a vaccine before that period of time. Most of the experts with whom I have consulted tell me that they really feel it'll be at least 12, probably 18 months. The good news is that viral testing or vaccine testing is underway.
Does an N95 mask actually help?
Yes. The one thing, though, about an N95 mask that most people don't think about, medical professionals in the course of their training and preparation to take care of patients undergo what's called a fit test. Masks can be of different sizes. Humans' faces are of different sizes and configurations. And to really be sure that an N95 mask or any other protective equipment is working well and properly, one needs to undergo a proper industrial fit test. Now, under the circumstances, we're not going to be able to do that. But be sure that the mask fits over the nose very nicely. That most of the time they have a metal bar on the top. Be sure that it fits tightly over the bridge of the nose and around the edges of your mouth. The other thing is there are usually two bands, rubber elastic type bands on these, and one, the bottom one goes over your head and around your neck, and the top one up around your ears and sort of the crown of your head to make it fit up against you in the most appropriate fashion.
All right, thank you. When do you think more tests will be available in this area?
Well, the health commissioner sent out a notification yesterday. More testing is coming. There will be a first flight of test availability in those areas in the United States that have the highest incidence out on the West Coast. And then I understand that we are in what I think was called Tier 2 for availability of testing as sort of the next site for the state of Virginia.
And once one is tested, how long does it take to get those results?
Okay, that's a great question. There's two different test avenues. One is one that goes to the state lab, and there are criteria that I had mentioned before for those that go in that manner. That's usually about a 24-hour turnaround. For those tests that are done by private labs, such as LabCorp, that's a little bit frustrating. Those turnarounds can be as short as 3 days and as long as 6.
All right. And again, what qualifies someone to be tested? I know you've already answered that,
Yes.
but people are coming in on the
Sure.
chat as we speak.
So I would direct everyone to the VDH website. It has a link on there to the specific criteria for testing. It has to do with physical symptoms, travel history, contact with people with COVID. It also has to do, and this is another thing for people to think about, one would want to rule out routine influenza or other parainfluenza or other infectious diseases. So for the state testing, influenza testing needs to be done first. It usually takes about 24 hours for influenza testing to come back. If, however, the clinician feels there's a high level of suspicion of COVID as versus influenza, often the influenza test is obtained and the COVID test is obtained at the same time. The anxiety about this I can certainly understand, and it is certainly one of our choke points and bottlenecks in dealing with this problem.
And are there lasting effects to the lungs of someone who gets this?
It's a great question. And so here's how to think about that. So if I'm an 18 or 30-year-old person and I'm a non-smoker and I've lived in a place like Hampton Roads as opposed to a place like Wuhan, China, or in a very industrial city, I probably have very good lungs if I do not have asthma or have had no other serious illnesses. Those lungs have a lot of capacity to sustain a viral impact and then heal and get better. There's a lot of reserve. Take on the other hand, a 75-year-old your grandfather, your grandmother. They look pretty good. You know, we hear people say all the time, oh, he's a great-looking 75-year-old. Well, I would challenge you. You take that 75-year-old perfectly healthy and that 30-year-old and you have them run a race. Or you have them walk up 4 flights of stairs as fast as they can. Who do you think's going to win? I believe it's going to be the 30-year-old. And the reason is they have a younger physiology, a younger set of organs, a younger lifestyle. They're more fit. So the point being, the 75-year-old may look good, but let's think about it. Maybe he or she was a smoker. Maybe they had industrial exposures, wherein with their lifestyle, with the speed at which they go about life, it works just fine. But then you have an injury, such as from COVID virus, and that lung becomes further damaged, and now it's very evident.
All right, and so some of this might be a rumor check. Let me see. Oops, I've lost the question. They've heard that H1N1 is making a resurgence.
Well, that's a great question too, and I'm aware from talking to leaders in the health system here that many of the emergency room physicians and nurses have seen a significant regular flu season.
That I know.
And frankly, unfortunately, in the last few weeks, a increase in the regular flu patient presentations also. That's not unusual that what we can call a bimodal, a two-mode process of an infectious disease can occur. Most of the time we're lucky with the regular flu and that doesn't happen. It sometimes has to do with how effective our vaccines are. And I probably should mention also, you know, vaccine is a hopeful thing, but remember, vaccines have an effectiveness, even with the regular influenza, of probably around 60% at best, and more commonly in the 40% range.
All right, now Bianca has heard that using too much hand sanitizer isn't good. Is that true?
Well, I don't know if too much of a good thing is bad or not, but I doubt it.
Okay.
I think of the old country song, I've never had too much fun. And so unless you are, to not be flippant about it, I don't mean to be that way, it's a serious subject. Unless you have a skin allergy or something of that nature, I know of no evidence that you can use it too often or too much.
What would the dangers be for pregnant women or breastfeeding or infants?
At this point in time, there is no clear evidence. Again, that's on the CDC website, and it appears that one should carry on with normal activities as usual. There does not appear to be any increased risk of transmission, though it can probably be transmitted. We really haven't proved it yet. But the guidelines are on the CDC website.
What would be appropriate for when people might want to wear gloves? Maybe when they're cooking or
that's a
any
wonderful
other type
question.
of thing?
So let me say this, and some of the dirtiest things that we have are doorknobs. And one thing I've been going around telling people is, you know, normally you would shut that door. If you can leave that door open in your business, in your community, now if it's a fire door, I'm not going to get in trouble with the fire chief here. You have to follow the rules there. But if it's not that, leave it open. Don't have to open that door, because doorknobs are a particularly great source of bacteria and viruses. Gasoline pumps. One of the dirtiest places that we all interface with every day are the gasoline pumps. Use gloves there, and I think you can do it one of two ways. You can either have an old pair of gloves that you put in the trunk of the car, and as you get out to do that, you use them each time, put them in a little plastic, you know, a Ziploc bag, and use it that way. Or you can use disposable gloves. I have to tell you, prior to all of this, starting about 5 years ago, when I pump my gas, I use a glove.
Interesting. I put a sanitizing wipe around mine today when I stopped at the pump. Let's see. Some of these are duplicate questions. Let's see. How long do you think this is going to go on? I don't know that that's...
Well, let's talk about that just a little bit, and I understand the nature of that question, I think. The honest answer is we do not know. However, everything that you are seeing promulgated about how to mitigate this is all for the purpose of saving lives, decreasing illness, and bending that curve that I was talking about earlier, so that we don't have a high peak, we don't have a broad incidence of disease. We want it to come up, level off quickly, and go away. And so that would be my comment to that. If we look at historically, in China, they did a fairly good job after they got going, and it started in December, and now here we are in March, and they are seeing every day fewer and fewer cases. So you can do the math on that, December to March.
All right, and Susie, I think, specifically wanted to know, should she wear gloves when cooking? And I probably didn't read that as explicitly.
Yes, I do not know of any guidelines that is necessary. The other thing to think about in gloves with cooking is whether they are fire retardant. You know, if you're cooking over open flame or whatever, you would want to be careful about that. But I know of no data that says that is necessary.
Okay. And let's see. I think.
I feel like I'm hogging the microphone.
I know. We're winding down on the particularly health department questions. I know that you're going to need to step out, so let us know when that happens. And I'm going to go back up to some of the city or region-wide and ask City Manager Mary Bunting, what are we doing? How are we acting as a region? What are the closures and efforts that Hampton, but also other cities, are taking to slow the spread?
Sure, I'm glad to talk about that. But just in case Dr. Julian ends up leaving us, I want to just thank him for being here today. I mean, he's been really insightful, and we appreciate you spending time and dropping in with our residents virtually, and the wealth of information and your candor. We're all very impressed with you and glad to have you here in our health district.
Thank you, Ms. Bunting. It's my pleasure. I will say just very quickly, we do have an emergency operations center, which maybe you're going to talk about, and I am so grateful to the fire and rescue and all the personnel that are involved. I'm also very grateful for the cooperation that is occurring with all levels in our medical care system, all the health systems, individual providers, urgent care, everyone in the healthcare community is really pulling together, and it's quite gratifying to watch. Thank you.
Great, thank you. So with regard to what the city and the region are doing, I want to, some of you watched yesterday's session may hear me repeat a little bit of information, but for folks who are turning in today for the first time, we have been actually working this, dusting off plans, following the health department guidance for several weeks now so that we would be prepared to make some of the decisions that we've had to make. And I will say that before we make any of those decisions, we are very data driven. We are trying to really follow health department and national organizations like the CDC guidance so that we can help flatten the curve, but also not overreact or underreact in that. And so that's why we look to our health professionals to help guide that. The regional managers talk often so that we can try to be coordinated in our response. In particular, we have had fairly frequent conference calls to understand what's going on both on the peninsula, specifically since we had the first cases in the James City County, Williamsburg area, but then also more broadly throughout all of Hampton Roads. And many of us, those localities on the peninsula in particular, made the decision to make similar closure decisions at the same time so as to not create confusion for our public. So last Friday, we decided to close our public facilities for 2 weeks. Initially, that may be extended as the health department guidance provides. We did that to basically stop bringing the general public in. It was a decision that was hard to make, but made easier by the fact that we realized that we could handle most basic daily services electronically or telephonically. So while the city facilities are closed, I want to assure you that the public can still access city government services. Most of our employees are showing up to work. We have developed department by department plans for all of our employees to either be socially distanced and or telework, because we want to make sure that our employees are protected as well. They're very important to us, and if they start to get sick, our ability to honor our commitment to the public will be compromised. And frankly, we don't want our workforce to be ill either. So every department had a sit-down meeting with myself and our human resources department, our legal team, to make sure that we were making plans for individuals to telework and or be socially distanced. And in that way, they can service the public even though our facilities are closed. We closed community centers, libraries, places of congregation, really before we got to the 10 people or less guidance because we were trying to help flatten the curve. We also, before we closed our public facilities, made the difficult decision to cancel large-scale events, like events at our Coliseum and our Convention Center. Again, in the guise and hope of flattening the curve for our health systems and hospitals to be able to better treat those who are seriously ill and need that attention. We do have some facilities still open to the public, like parks, and that's predominantly because we understand that being outside in a socially distant fashion has some positive benefits, both from a health perspective as well as from a mental perspective. Getting out in fresh air really refreshes our souls sometimes. But we are encouraging and monitoring our parks to make sure we're not having large gatherings of people, but just providing a safe, healthy way for people to go out, take a walk, enjoy fresh air, and then go back, hopefully, to a home environment where they are isolating.
Thank you. Actually, Mary, that was one of the questions I was going to shoot to Dr. Julian about, is it safe to go outside and be outside?
Yes, there's no indication that it's not. As a matter of fact, it might be good for both your body and your soul under these circumstances.
All right, and Susie has heard there were some drugs used in China and South Korea and Italy. Is that something that's been effective? And if so, do we have that in this country or region?
So there are drugs that are available for the common flu that are antivirals that do shorten the disease process and mitigate its impact. However, there is only one drug under development right now for use with the COVID virus, and the studies are not complete. So we really do not know. Over the course of time, we will, but there are no drugs that are specifically identified, FDA approved, and we're certain that will mitigate this virus as opposed to common cold and influenza.
All right, well, thank you so much. Again, Dr. Julian's going to scoot out, and we're going to really focus on questions about the city's response. So for those of you who have been very patient, I'm going to go back up to the top. And there were some concerns about EMS and firefighters and police. Do they have the proper safety equipment? I know you guys call it PPE. What does that mean, and what is the city doing?
We'll start, Chief.
Sure, I'll take this. Fortunately, we prepare for things like this well in advance prior to a pandemic because we are the first line of defense when it comes to something like this. And when we first started hearing about the outbreak, we made sure we took inventory. And it wasn't just inventory in fire and rescue, it was inventory with police, emergency management throughout the city, and identified that we did have a sufficient amount. However, we don't know if that sufficient amount will last the duration of this pandemic. We don't know how hard we're going to be hit. So we're constantly seeking out additional sources. In fact, today we received another additional source from another company who reached out to us stating, hey, we'd be willing to donate this for you. So we're going to go ahead and keep the stockpile. But when, Robin, you talk about PPE or personal protective equipment for us, in cases like this is going to be the N95 mask. There are various versions, but the N95 is the identifier for it. We say eye pro, and that's eye protection, because this is an aerosolized or droplet-based virus. We need to protect our eyes, and gowns as well. So we are prepared for that, at least in the short term, and we're working on plans in the long term, and we've included law enforcement and public works in that as well.
And Chief, did you need to add anything, Chief Salt?
He's covered it pretty well. From the police department perspective, one of my big concerns was the N95 mask. Do we have enough? And slowly but surely, we're beefing up our stock. Every officer has always been issued a personal protective equipment pack. And in that is included the gloves, the eye protection, and also the mask. We are now updating that stock and getting more and more so that we can follow the guidelines as set by professionals like Dr. Julian.
Thank you. And Mary, somebody wants to know if there's anything in place for other city employees rather than our first responders who may be dealing with the public.
So again, our goal has been to limit the interchange between the general public and our city employees as much as possible, hence the public building closures. In our offices, we are social distancing or teleworking, as I mentioned earlier. Where we do need to have direct interaction, we will make those decisions on a case-by-case basis. For instance, if we needed to visit a home for a child protective services case, then we would be dealing with that on that individual worker. But because of the amount of PPE available, we've had to prioritize putting those masks into our fire and EMS and police officer services where you're going to have the most direct interaction with the public.
And somebody else, well, Christy was the one specifically, and she referenced the 62 firefighters now on quarantine in DC, and I know there are firefighters quarantined in Washington. What would be the plan if any of our EMS or fire workers or police or really any city worker was exposed? Why don't you talk first about
Sure.
fire?
Once again, this is new to all of us, and we have a lot of plans on paper, but we haven't tested those plans in real life. However, Dr. Julian mentioned something earlier tonight about interdependence. And in a prior meeting to him, he made the statement that we were a country founded on independence, but we're having to quickly learn to be a country founded on interdependence, where we rely on each other services, other city departments, other agencies to help plan this. Now, we have worked with the city manager and others within the city to create a plan that if we needed to quarantine on site, or if we needed to quarantine in another location in the city, or if it's a self-quarantine at home, those decisions are made in conjunction with the medical facility and Virginia Department of Health, along with the city, of what is best for the employee. We made it a point today in the fire division to meet with each one of our stations to go over the guidance that we've provided them to make sure they understand them. And that is one of the common questions that comes up of what's going to happen to me if we need a quarantine. So we will be prepared for that. We don't know exactly what it's going to look like when it happens, but we're going to hit the ground running when it does.
We'll also take a moment to note that Hampton is very blessed to have a cadre of volunteers that practice and are fully integrated with our fire division. And many localities don't have the benefit of that combination department. So big shout out to our volunteers who are always there to support our fire department.
And someone asked if employees who may have been infected in the course of their jobs need to be quarantined, what would be our procedure for that? I don't know if we even have it yet, but what's the thinking?
We have made a variety of provisions. Obviously, we would be alerted by the physician or the Virginia Health Department. We have made some provisions. I prefer not to get into them publicly to protect the employees who may be in that situation, but to provide sheltering for our employees who do need to be quarantined so that they don't take that illness into their home. We would absolutely be taking care of them. We've also provided a special leave benefit for our employees related to the COVID-19 if they are diagnosed or are asked to self-isolate or quarantine because of suspected contact from their family members or others. We do now have a special leave benefit, so our employees do not have to worry about their absence from work. They may not have enough leave balance, or they may be worried if they're a part-time worker or a WAE, which is basically an hourly worker, they might be worried about not getting paid. So we've made all of that perfectly clear to our employees that our goal is for them to be at home and not worry about pay so that we don't worry about the infection to others.
Now, Bianca asks, will there be more options for online services? And I'm going to say, Bianca, why don't you be specific and let us know what you're looking for? Mary, we have announced some expanded online services. Do you want to talk about those?
Right. Well, we have always had a fair amount of online services available for our public, and it would really help to know specifically what Bianca's interested in. But for instance, there are some services in our community development department, permits and site plans and land disturbance permits and those kinds of things, some of which you could always do online, some of which you could not do before, but we've escalated plans to be able to accept online applicants for those kinds of things. We've also made it easier to do online services. So for instance, with our treasurer, if you have a tax payment that's due, typically there's a fee to use your credit card. We have waived those fees so that you don't have to worry about paying extra to avail yourself of the technological solution.
So today added a phone line where you can pay with a credit card via phone, and all that information is on the city's main site and also on hampton.gov/treasure, I think it is, but on the treasurer's page.
And there's some of those technological solutions, again, that have always been out there that people don't take advantage of. I'll give a plug for our libraries. You've long been able to check out books electronically through our library, and again, since you have maybe more time with children at home, or other adults are being at home longer than usual, and maybe you want to take up a book, but we don't have the library open, don't think you can't get a book. You can still do that online through our library services.
You can get a book, ebook.
Well, an ebook, right. I'm sorry, to be clear, an ebook, but it's the literature that you would still be able to access.
Yes, and you can read newspapers on their online services as well.
Right.
We have a question that I know we can't answer, but I'm going to call it out anyway. Will mortgage payments or interests be postponed?
All of that is a private sector industry question. I do know that there are some determinations that are being issued by the federal government and the state government. For instance, there have been pronouncements about holding off evictions and things of that nature because the court systems are closed. But ultimately, the local government cannot mandate to a private bank, lender, the variety of other things we've talked about, landlords, those kinds of things about the practices that they will undertake. Virginia is a Dillon Rule state, which means that the localities only have the powers expressly granted to them by the state General Assembly via the state code or their charter. We may have some really good ideas. For instance, earlier this week, I know a citizen reached out to the mayor and suggested that we mandate that grocery stores open an hour earlier for the elderly and vulnerable populations before others could come in. And as much as that was a great suggestion, we did not have that power because of the Dillon Rule to mandate that. We did, however, share the suggestion, and many retailers are now adopting that practice. So where we get ideas, we do share them with businesses to suggest that these may be ways that they could help our residents. But I want to be clear, we don't have a lot of the powers that people sometimes think we have.
No, but I really have seen a lot of businesses stepping up. There are some businesses that are opening for seniors only, and that morning, right after everything has been disinfected overnight, there are local restaurants who are doing delivery or takeout services. I mean, I have seen a lot of good voluntary efforts by our businesses to try to help people meet their needs.
Absolutely, and while we're on the social generosity of our businesses, I also want to acknowledge that many of them have participated with our school system in offering lunches for our students. That's a big question we get about schools being closed, especially for people who don't have kids in schools. They may not be aware of all the great plans our school system has developed. In addition to developing ongoing instructional packets for the students, they have maintained a breakfast and lunch option for our students. Many of our students are on free or reduced lunch. They do depend upon that breakfast or lunch to supplement their nutrition. And the school system executed using the summer feeding sites as a place where we can get those meals to our students each and every day. But in addition to that, we had a multiplicity of businesses, and I don't want to call them out because I don't want to leave someone out inadvertently, but we've had a multiplicity of businesses step up and say we want to help our kids. And it's just very rewarding to have a community come together and really make the best out of a bad situation. So kudos to our community.
Okay, and Christine specifically asks about a treasurer personal property bill that is usually waived by bringing in our LES. I don't know what that is, but I do know that just because the buildings are closed, the staff is still working. Call, you can probably fax or email in a scan of that and get that taken care of over the phone. They will work with you, whatever it is.
Absolutely.
Someone wants to know, Joanne, is there a help hotline for seniors, or is there something we're doing for seniors in particular?
So again, seniors are suggested to be staying at home. That's really important because of the vulnerability that Dr. Julian talked about earlier. We do have many community service groups that are working in support of our seniors, as well as our Department of Human Services makes various, depending upon the needs of the seniors, various kinds of considerations. For instance, we have some who are very vulnerable and require checks. Through our adult protective services, we would be doing that. For those who are able to be very independent at home, and what we find is a lot of neighbors are willing to look in on their elderly friends, call. I've heard many stories of neighbors going and getting groceries for their senior friends so they don't have to go out in that hour early situation. We've talked a lot about dropping off items for people at the outside their door, calling them and saying, hey, I'm here with the groceries you needed, or whatever it may be, and then leave so the resident would know, and then the resident can come get it, and we minimize exposure and keep that social distance. So there's a variety of things that we are doing on an individual level as well as a community-wide level.
And Mary, I do have a couple questions about city employees. How will they be paid? And another question about what if they aren't ready to return after the 14 days or can't get a letter, haven't been tested because they weren't high enough priority for that?
Okay, well, we'll put out an additional frequently asked questions for all the details about employees and their individual situations, and frankly, some of those will be individual situations that we will have to deal with as they arise. But city employees, my plan right now, and I've shared this with council and they concur, is that we want to continue to pay all of our full-time, part-time, and WA employees on their regular schedule for whatever their normal work schedule would be. We do want them to work for that pay, and we are making provisions for them to be able to do that. Again, whether it's telework or in their normal setting, socially distanced. In some limited cases, we have employees whose job is very specific, and it's tied to a facility or action that we've taken to close a particular functionality. Like maybe I work in the library, and there's really not enough work to do with all the libraries closed. So what we've done is look at the skill set for that employee and other areas where we may have additional needs because of this pandemic. As an example, library employees are very good at customer interaction. Well, we may have higher call volumes in our 311 call center, so we can use some of those employees at our 311 call center. So we, like I said, we met earlier this week with each of our department heads to look at every one of our employees and or groups of employees to say, are they going to be in the field as the case of first responders? Are they going to be teleworking? If they can't telework, what can they do in a socially distanced fashion that is in support either of their department's mission, or if they can't support that department mission, where can they support elsewhere? By doing this, we can assure that people who do show up to work will get paid, whether, again, they're full-time, part-time, or WAE. Now, the COVID leave specifically that we've offered, we fashioned that after guidance provided by the health department in terms of the reasonable expectation someone would need to be out of work, and that is that 14-day period. If that guidance changes, we would look to amend our leave policies. But for right now, we've been assured that the 14-day period is the proper time to plan for.
Okay, and oops, I've lost what I was going to say. There's some folks who are asking Mary about what are we doing for people that are out of work. I'm going to say that's really being handled on a state and federal level. I know that on hampton.gov/top news, we have a link to the governor's information. He is changing the restrictions on applying for unemployment, speeding things up. He's got programs for businesses, and the federal government is working on some legislation for relief as well.
Absolutely, that's the best answer there. There is, again, a limit to what local government can and frankly should do. We're trying to take care as much as we can of our governmental services and the people who provide those governmental services. Where we don't have that direct ability, we try to influence the private sector or higher levels of government to take the appropriate actions within their purview and power to do so.
All right, and Chief Philp, speaking of the governor's orders, the caller wants to know if you are enforcing the orders to have no more than 10 people in a confined space or a business at one time.
Well, the short answer to that is yes, but it is not like you might see a heavy traffic enforcement or driving under the influence enforcement type thing. It is a partnership with the health department. Actually, the health department is taking the lead on that. And so kind of the process is we'll be kind of complaint driven. It'll initially go to the health department for evaluation. And at the end of the day, we're looking for compliance. And we want to do everything we can to help businesses succeed and making sure they can stay open and do that, but also protect the public. If for some reason that the health department doesn't get satisfactory results there, then we can be called in, and then we will do the same thing, try to work with the owners and try to get compliance. Ultimately, at the end of the day, if we can't get voluntary compliance, then we may issue a summons or up to and including arrest.
Okay, thank you. And Mary, if you could, I know you don't technically speak for the school department, but you're in very close contact with them. We have a number of questions about what if it's longer than 2 weeks, what about online services and distance learning for our students?
Okay, well, I'll share what I know, stipulating that Dr. Smith has an emergency management team that has been very actively involved, and while they keep us informed, we do trust them to do the work of education. That said, our school system was very well positioned to provide for distance learning because we've made the investment for many years now to have a one-to-one device for all of our middle school and high school students, which means they all have a Chromebook at home with them already. I know some school divisions are making provisions to provide these devices with the crisis, but we have had those, and our students are used to working with them. They're used to receiving their lessons that way, submitting their lessons that way, and receiving information from their teachers on a regular basis that way. Now, before the schools closed, in anticipation it might happen at some point, our school system did a telephone survey of parents and learned that 96% of them had access to internet to support the learning. And in terms of the 4% that didn't, we have a variety, and I can't promote any one particular company over another, but a variety of internet providers that are offering either very low cost or free internet service to support those middle school and high school students. So that's there, and they can continue to roll out instructional packets that way. For our elementary students, they developed an instructional package which parents were able to pick up and or could download from a home computer. So while none of us want this to extend very long, if it does have to extend, we've heard from the health professionals that may need to happen. I have every confidence that Dr. Smith and his team are having evolving planning to support each increment, whatever it may be, in terms of the extension. And as I noted earlier, but just in case people are turning in late, they have also made the provisions for the food service to continue, and I know that those would be able to be supported throughout the duration of the closures.
All right, and Sky wants to know, are we reducing lines in grocery stores and keeping fewer people in there? She says people are not adhering to social distancing. I'll tell you my experience. I went to the drugstore this afternoon. People were spaced out in the line voluntarily, and I think there's an awareness growing out there that this is what we all have to do. It's not just the responsibility of one person or the business owner.
And the thing I would say about that too is, again, local government doesn't have the ability to go in there and regulate that. But one of the best things that can help is for us all to remember that the supply chain for restaurants and drugstores remains very open and viable. These grocery stores are getting daily or maybe even multiple times, depending upon the store, shipments to their stores to restock. And although we're all hearing that as soon as they stock, everything gets taken off the shelf, it should be comforting to know that new trucks come every day. So there isn't really this need to rush and overstock. And I think it's really important that we all remember that, because that behavior typically is is necessary when there's not going to be a supply chain continually delivering goods and services. But so far, there's absolutely no indication that the supply chain of toilet paper or groceries, other supplies are going to be interrupted.
I think, when you say have enough on hand for 2 weeks, there is this sudden spike in need that doesn't exist any other time. And that curve, again, will be leveled out as we go on through and as more supplies arrive.
Well, and I think people are naturally worried that we're going to be quarantined and not allowed to leave our home to go to the grocery store. And what I want to say in terms of following some of the states and localities that have been more quickly impacted, that in all of those cases, and you see this in the governor's orders as well, that as we tell people not to congregate in large groups, whether it's restaurants or theaters or those kinds of things, there are always provisions left open for places like grocery stores and pharmacies and drugstores, because there is a recognition that those are essential for daily living. And while, yes, we should minimize our trips to the grocery store if we can, that doesn't mean we are looking at being precluded from being able to go to the grocery store, at least in the immediate future.
Mary, these are questions you may not be able to answer from the school side of things. Do you know if teachers are being paid, and do you know if students and teachers will need to make up the days that are being missed?
I do not know for sure any of those things. Some of those are in flux, particularly the latter one. The decisions about whether time needs to be made up or not really come down to the State Department of Education's determinations. There is a provision in the State Department of Education regulations that allows, in unique circumstances, for there to be a waiver of the time missed. Those have to be done by application, as I understand it, or the governor needs to just flat out declare it. And those decisions have not yet been made, although this certainly classifies as one of those unique situations. But I cannot speak for the governor or the Department of Education. I have not specifically asked Dr. Smith the latter question about teachers, but I know that they have been working. They were in the buildings earlier this week, and then when the buildings had to close, my understanding was they were teleworking. So I can't speak to the long haul, but I know if they are working, they are getting paid.
Thank you. Chief Salt, there is a rumor out there that some cities are reducing arrests to limit exposure to police and to those already in jail. Is that something you are contemplating?
There are significant changes that we're doing. I think both in police and fire, the fire chief and I have been working together on a lot of issues to minimize social contact. One of the things that we look at are what are our alternatives to putting handcuffs on someone and taking them to jail. We're still going to hold people accountable, no matter what. But officers have discretion in a lot of cases, particularly misdemeanors, where we might issue a summons where we would otherwise take someone to jail. We are reducing some of the calls for service that we're going to, and I'll go ahead and announce that. I think we talked about it in our last session a little bit. But our officers, when you call 311 or 911 or the non-emergency number for a police car, if it's a lower priority call, that's where there's no suspect on scene, there's no evidence to be gathered, maybe it's a civil matter, or maybe they just need some advice. A couple of things we're doing. We're putting some representatives in the communications center to help advise law in certain circumstances, and so that will be handled over the phone there. If a police report needs to be made on a lower offense such as this, then the officer who would normally respond in person may make a phone call to the victim and take the report over the phone. Now, if this occurs, this is not an option. The officers are under orders. This is in the communications section that this is what will occur. Normally, if you request a car, we would send one to you. That's not the case right now in the state of emergency. But we will provide the same level of service. In other words, if a report needs to be taken, we'll take that. If there's any injury or threat of injury or any reason that the public safety or property is in danger, immediate danger, we're going to be Johnny on the spot. We're going to be right there. Actually, we might be there quicker because we're not doing some of this lower end stuff, or we're getting it done over the telephone. So I ask for you to bear with us on that. There's still services in the police department that you can get even though the building is closed. There are a lot of things like if you're in an accident, you need your car's towed, you need to get a tow slip to get your vehicle back. We will still accommodate that. If you have evidence in our evidence room or property that was lost and it's been found by appointment, we will make sure that you get that. There are a few, we can get reports and that sort of thing online. But there are some changes in services. I ask the community to bear with us as we go through this, because we're trying to limit not only the exposure to our citizens from potentially a police officer who's gone from place to place, but also exposure to our officers as well, so that we don't accidentally cross-contaminate to some other location. And I know the fire department has some changes that they've made.
Yeah, that's a great segue to the social distancing. And Robin mentioned that there's an enhanced awareness now. It appeared in the drugstore. People are distancing themselves. And the hospital has taken similar measures. But as first responders, when you call us, we need to be able to come and assist you. If we get sick, there's fewer of us to be able to do that. So we have to take sometimes make the hard decisions, take the hard measures to make changes to reduce that risk to us. One of those changes I'd like to put out on behalf of our members is community within the city. If you call for your family member to be transported to the hospital, oftentimes we will allow you to ride in the front seat of the ambulance on the way to the hospital as a courtesy. We're going to need to change that today. In fact, that started today. Now, this is a perfect forum to be able to announce this to the public so they are aware just as much as we are. But if you do call and you have a family member there or a friend that would like to ride with you, we will not be able to allow you to do that, because we also need to protect our members from that. Now, there are only 3 cases where we would allow that to happen. So if the patient is a minor, obviously we need to have a parent or guardian there with us. If you need to be present to help communicate for the patient to the hospital staff, we can do that. Or if you are the historian for the patient, we can do that. Now, these are in alignment with what the medical facilities are requesting that we do. They actually have a 0 visitor policy unless those conditions are met. So we would hate to bring you to the hospital, put our members at risk, and then you get there and you're not able to enter the hospital. So on behalf of all the fire division members, we ask that you, when the member tells you, please find another way to the hospital, maybe we can assist you with that. Comply the best that you can, because that's going to help keep us safe.
And Chief Salt, you had something you wanted to mention?
Yeah, absolutely. There are a couple of things that you might have a question about, but one particular you might see is that you'll see that in the Christmas time, sometimes we'll run static lights or lights, the blue and the red lights on the patrol cars. You're going to see that through this period of time. We are increasing our visibility, make sure that if you need a police officer, you know where they are. And so you're going to see our officers doing that going forward. And I also want to reiterate that what we're talking about here on our over-the-phone responses, as opposed to going in person or doing a summons instead of arrest, we're not talking about serious crimes here. We're not talking about break-ins, or we're not talking about assaults or things like that. Those folks are still going to jail. Violent crimes, absolutely. We still have a priority of guns, gangs, and drugs. If anything, we'll be intensifying on that, our enforcement on that. So this is really things like information for a police officer, or I've got a question, or it might even be a stolen vehicle where the vehicle is gone and there's no physical evidence at the scene. We can get all that information over the phone. But if there's physical evidence that might have been left, we're still going to come and we're going to go in person for that.
Okay, thank you. Mary, I do want you to know that Constable Heartless says that the pirates are ready and willing to do anything they can to help the city.
Thank you, Constable.
And also there's another question about, do we need volunteers? Would the emergency management volunteers be called up? I mean, what do we think that citizens could do to help the city?
At this point, and I appreciate all those offers, and they're really heartfelt, I know. At this point, I think we're good with what we have, but that doesn't mean we wouldn't call up our CERT volunteers or others later. I think the most important thing for volunteers, people who are civic-minded, to do right now is to focus on those vulnerable populations we've been talking about. Check in telephonically with an elderly individual, help out with some of the feeding drives. I know that there are various groups like the United Way that are working on campaigns to help people who have major financial difficulty as a result of this crisis. Of course, the federal and state government may be taking action to help too, but in the meantime, there are opportunities to give through those established organizations. So there's lots of opportunities to help. We really need to make sure that in terms of our public safety response, our human service response, we're doing things in regard to HIPAA violation, HIPAA law, making sure we don't have violations, protecting the workers that are coming into contact with people. And because there are limited supplies nationwide, we need to make sure we reserve those supplies for the workers right now who must respond. If we could get more supplies, if the crisis grows in our area, then we may need that volunteer base, but I wouldn't want to activate that base until we have proper supplies for them and until we absolutely needed them. And I do want to note that as of right now, we still do not have any confirmed cases in Hampton. That doesn't mean we won't eventually, but just as we try to flatten the curve in terms of those who get the disease, we want to make sure we reserve all of the resources, whether they're paid or volunteered, for a long duration, because the more we're successful in flattening the curve, the longer it's going to last, and we don't want to wear out everyone's energy and ability to support this crisis by really calling and activating all those volunteers right now. But we do appreciate all the offers, and when and if we need them, we will certainly take up those offers as appropriate.
Okay, thank you. And Bianca wants to know, can we ask questions in the neighborhood app? And the police have already responded, but I want to say out loud, if you post on Nextdoor, we can't see it unless I happen to live in your neighborhood. When you create a post, it's not citywide. It goes only to your neighborhood, and we have no ability to see it. If you truly want to comment on our post, we will try to keep up with those. You can also look at Facebook, look at Twitter. We're answering as much as we possibly can. You can call the 311 call center at 727-8311. There are lots of ways you can get your questions answered. And do you think that we're winding down? Does anybody else have anything they want to say?
Well, Robin, I noticed that someone asked the question about supply chains and saying that the supply chain has already been interrupted because there's no toilet paper anywhere. And I do want to assure you that this toilet paper is still coming to the community. I have an early rising husband who's been at a store to get toilet paper in the morning, and it is there first thing in the morning when these grocery stores or department stores or whatever are opening. The problem is everybody's going in and getting it, and then later in the day, the shelves are empty. But more toilet paper keeps coming to our community. So I just want to assure you that when I say the supply chain is not yet interrupted, and we have no indication that it will be interrupted, some of it is just taking patience and being, and then those who are able to get it not taking more than they should or more than they need. I know a lot of stores have started to implement you can only buy one package or two packages so that people can have more of it in the community. But I know it feels like it's been interrupted, but in reality, those supplies keep coming on a daily basis.
Yes, and the same thing with hand sanitizers, with cleaning wipes. Those are getting restocked, and I'm just going to say, don't buy more than you really need. Let's leave some for other members of the community, or buy something for a senior citizen in your neighborhood. But there's not, at this time, a real need to stockpile lots and lots. And one more question that I also don't know if we can answer. Mary, what about small businesses like hair salons, tattoo parlors, places where there may not be more than 10 people at any one time? Is there any guidance on those?
So I have to say that all the decisions about what can be opened and what needs to close and how many people can be in an establishment and the protections that need to be taken for different types of businesses, all of that comes from the Virginia Department of Health. And it's not that I'm trying to be evasive or that our employees will be evasive if you call about that, but we are not medical professionals. So we want to steer you to the right source for information. And the only entity that can really make the decisions about whether to absolutely close a business or enforce a certain level of attendance in a place is the Virginia Department of Health. We can make decisions about our own city facilities, whether we choose to lease them or not, which is why we did cancel some of the Coliseum events and Convention Center events, and we had the authority to do that because they were our buildings to lease. But in terms of private sector businesses, we do not have that ability at a local government level.
Okay, thank you. And
I'd like to mention too, in regards to that, is a lot of the information that we make decisions off of, and you heard Dr. Julian make some examples of that tonight, they're readily available on the internet through the CDC, through the Virginia Department of Health, and other sites that are legitimate sites and not opinion sites, particularly if they're scientific related or if they're health department related, and I would encourage people to look there.
And I would say, too, two of the buildings we own but don't operate, the Boo Williams Sportsplex and the Virginia Air and Space Center, have decided to close.
Yes, ma'am.
Alice wants to know if there's any relief tax-wise for people who lost their jobs or on reduced hours.
Again, those kinds of tax decisions are going to be made at federal and state levels.
Well, if we're talking about the personal property tax or property tax due June 5th, what I might say is call the treasurer's office, let them know. They may or may not be able to work out a payment plan, but locally, talk to someone. Don't just not pay. Call in and tell people what's going on.
Right, and I want to go back to even though those are local taxes and you may be able to set up payment plans or arrangements, as you rightly point out, the due dates and things of that nature are really statutorily set. So we go back to the Dillon Rule and the ability for local governments to make decisions about that really being driven by state law and state precedents. So not trying to be difficult or anything about that, but we really have a legal construct we have to work within, and we're not always given that flexibility that people ask us to consider.
Well, speaking of statutory things, there's a June 5th election coming up. I've gotten a question about whether or not that will change and whether or not there could potentially be virtual candidates forums.
So we are working with the organizations that have traditionally hosted candidate forums to see if they would like to work in a consolidated fashion to do virtual candidate forums. And to correct you, our election wouldn't be June 5th.
Oh,
it would be,
I said May.
you said June.
Thank
yes.
you. I'm so sorry.
It would be May. And right now, the State Department of Elections have sent down guidance to the registrars to make absentee ballots and mail-in ballots more pervasive. So anybody who wants to do that can do that now. The date issue is not something that directly the local government can change. There is a way to change that through the governor's office and or petitions to the Virginia Supreme Court. But at this point, the registrar through the State Department of Elections is making more pervasive those mail-in types of opportunities for people who couldn't do that. There will be drive and drop options. Again, all that will be specified as we get a little bit firmer guidance from the state and the registrars, and they will be putting out their own the provisions provided by state law.
Okay.
But we understand that people, if they have an election come up on May 5th, would want to make informed decisions about the candidates, and that's why we have collectively reached out to consider virtual candidate forums.
Okay, and we do have someone who wants to know who the May 5th candidates are, and I will direct you to hampton.gov/voter. There's a list of the candidates. There's the deadlines for registering to vote, getting an absentee ballot, all of those things that we know so far, and we will add to it when we make decisions about drive-through and things like that. I do want to remind people that we have two numbers that you can call for information. The first one is the health department number. It's 757-594-7096, and that is staffed from 8 a.m. to 6 p.m., and that is specifically for questions about coronavirus or COVID-19. If you have a question about the city of Hampton, you can call the department number that's listed on their website page, or you can call 727-8311. 311 can answer almost any question, and if they can't answer it immediately, they will get you an answer. and also that you can sign up to receive updates. We are updating all of the interactions you can have with the city and what's going on with the city, a little bit of health department information we're sending out every day. Go to hampton.gov/top news or hampton.gov/coronavirus. And if you want to receive text alerts or email alerts when those things are posted, you can do that at hampton.gov/notify me. Is there anything anybody wants to add, Mary?
Oh, no, I was just going to, when we close out, we wanted to invite the mayor back to the stage. But I will say that we have a fantastic team of city employees, whether they're the visible frontline folks like police and fire, emergency responders, or the people behind the scenes. As you might imagine, in a crisis like this where we're doing more teleworking options and telephonic and electronic means for doing city business, our IT department becomes very important. And a lot of times some of these people who are very essential in emergency management aren't recognized by our residents because they're behind the scenes. But whether they're the IT professionals or the 911 dispatchers, who again you oftentimes do not see or know about but are part of our first responder network, or our public works people who are still picking up the trash. A lot of times I get that question, are we still picking up the trash? Absolutely. We will be there to take care of the sanitation needs, whether they're trash or wastewater. All those things are going on. And we have an incredibly talented team of dedicated city employees who each and every day, whether it's a pandemic crisis or not, really cares about the citizens and the community. And I just want to give a public shout out to my team of people who are there for our residents each and every day.
Thank you. And do either of the chiefs want to make a closing statement?
Well, I just think the city employees, the police officers, firefighters that are out there, and the emergency management team, those on the front line. Public Works is another one that Mary was referring to. They are truly first responders. They dedicate their lives to making sure others have a better life or a better opportunity. And they do this day in and day out. And when something like this occurs, they really step up to the plate. And I want to thank the men and women in blue, and also the firefighters, first responders, public works, and all of them.
And I'd like to go a little more global with that, and the fact that the city is built on community. And just as much as the community depends on the city to take care of them, this is a point in time where we are relying on each other. So when you hear social distancing, which is the buzzword, of course, but it's very important. When you hear hygiene, when you hear don't crowd in an area, those are said for a reason. And if we all have a social responsibility to heed those things so this does not spread. So as a city built on community, we need to all do our part in awareness and in social responsibility to make sure that we're doing the best that we can to keep this out of our city.
One thought to leave, to resonate. This is serious business. And if we don't watch out for each other, then it's going to become more serious. And so everything that Dr. Julian's talked about, everything that you're hearing, pay attention to it. No kidding, lives matter, and lives can be affected positively or negatively from this.
Thank you. Now we're going to call Mayor Donnie Tuck up to close us out. But before he does, I do want to say there are dozens of thank yous on here. Mayor, the city is being complimented for being so proactive and providing this straight information. So, all yours.
Great, thank you. And on behalf of the City Council, I want to express our appreciation and thanks to our city staff and employees who do a great job under normal circumstances, but who really excel in challenging times. And these are circumstances that are really trying us, but we are a resilient city and we will get through this. Thank you to our panelists. Thank you again for joining us as we continue our updates and information for our city's response to the coronavirus crisis. If you missed any portion of this broadcast, you can catch it on YouTube. And if you missed the first segment, which featured Dr. Steve Julian, who's the acting health director for the Hampton and Peninsula districts, among the things he said is to make sure you follow the guidelines related to social distancing as well as to hand washing. As the chief said, that we are a community. One of the things that you can do is to be a good neighbor, and that's to check on those you know have a special need. And if you're looking for ways you can volunteer, give blood. There is a shortage of blood, and we could use the blood donations. Thank you again for joining us. Have a great evening.